Thank you very much. Rob Roberts.
Thank you, Mr Deputy Speaker. Today's bill will help our healthcare system to become more accountable and less bureaucratic, allowing our brilliant healthcare professionals to focus on their job, providing world-renowned care to patients rather than filling in unnecessary paperwork. It allows our healthcare system to be flexible, adapting to meet future and local needs. And as my honourable friend from Meriden said earlier on, a one-size-fits-all approach is rarely the most effective. And today's bill will mean local areas can develop practices that best suit their needs. Now, this is something that we're acutely aware of in Delyn, as we have a much higher proportion of over 65s than the national average. Sadly, the Welsh Government's funding to the North Wales Health Board is significantly lower per capita than the Health Board enjoys in South East Wales. But, Mr Deputy Speaker, as you'll know, that's a debate for another time and place. Sadly, one of the major elements of today's bill which should be praised falls a little bit short for my constituents in Wales. The bill will lead to greater collaboration and integration between the NHS, local authorities and care providers in England, and ultimately this will deliver more joined-up working and the best outcomes for patients. Yet this move towards greater collaboration needs to go further, and we need to see collaboration in healthcare across all constituent parts of the United Kingdom. The NHS is not limited to one part of our country, it's nationwide, and when you're treated at your local hospital, you're treated by the NHS. Not NHS England, not NHS Wales, but the National Health Service. People don't see that there should be a difference, and frankly, don't care. Just as we should be united in our response to COVID-19, it's now the time for our healthcare system to work together across borders for the good of all UK residents. And despite holidaying within the same country, as so many people are doing this year, if a constituent from Delyn holidayed in Cornwall and needed NHS treatment, their medical records wouldn't be on file and would be difficult to access. And without immediate access to those medical records, I can't help but worry that this could affect the outcome and care received, demonstrating the need to share records between all 4 nations. The issue that I've raised is one of many that could be resolved through greater collaboration between the UK Government and the devolved administrations in healthcare, just as we saw with the fantastic vaccine rollout. Mr Deputy Speaker, I'd urge the Government to remember it is the Government of the whole United Kingdom, which should come with an overarching responsibility to care and look after all its UK citizens, regardless of the nation in which they reside. And as this bill progresses through the House, I hope the Government draws on the lessons it's learned from working together on the COVID-19 vaccine programme to consider further how greater collaboration in healthcare can be achieved between all 4 constituent parts of the UK to tackle public health issues that we collectively face.